and welcome to County Lines, where your life and government meet. This series is all about explaining the ins and outs of North Carolina county government. Each episode in this series will focus on a different facet of county government and give a behind-the-scenes look at the work done daily that impacts every North Carolinian. Public health is a critical service counties provide that consistently runs in the background to protect us from several health-related threats. The pandemic changed the way the public viewed local health departments, shining a spotlight on the important part they play in their communities. Public health covers a lot, and to understand more, we met with Transylvania County's Director of Public Health to learn about their work and the different ways they keep us safe.
County government is the structure that sets into place the many services that serve our citizens across our community, be they permanent citizens, tourist citizens, or part-time citizens. Local government sets that backbone and design of programs that serve everyone. Public health is one of those programs that local government facilitates, and you will find a local health department in all 100 counties in North Carolina. Health department is that silent miracle. We cover everything from septic to syphilis. And if we are doing our work and doing it well and doing it generally quietly, we handle problems and head off problems before they become an issue for the public. The breadth of public health work is very wide. It ranges from environmental health on the septic side. We want to put in septic and wells so that we preserve the health and safety of the groundwater in our communities, and we range all the way into communicable disease, which is a unique authority and power to local health departments, and that's the syphilis piece of it. We engage with preventive work around flu vaccines and vaccine preventable situations in children, diphtheria, measles, mumps, pertussis, those sorts of things. But then we also deal with communicable diseases such as syphilis, gonorrhea, chlamydia. Again, we want to be proactive and reach out and serve our community to put the preventive pieces in place, but then also to respond in an emergent situation, such as STDs.
Unlike social services, which is primarily funded through the federal government, public health is funded through a mixture of local, state, and grant funds.
Health departments are funded through a complex formula of local funds, state funds, fee funds, grant funds, and cash from receipts from various services. We are very fortunate in Transylvania County that they fund roughly 55% of our budget in the local health department, and we are extraordinarily blessed to have that level of support locally. Not every county is that fortunate. Some counties have greater tax bases upon which to call for infusing their various departments and programs with funding.
Public health departments are responsible for your safety in some of the most visited and cherished public spaces.
In our environmental health services, aside from septic and well, we are also responsible for doing inspections on your restaurants and your lodging institutions and your public access swimming pools. Public access swimming pool is any swimming pool that's not in someone's backyard. So if there's a swimming pool at a country club or a gated community, that's a swimming pool that we are inspecting to be sure that it's safe and has good water quality. Anytime you sit down in a restaurant, you have public health to thank for the education and inspection processes that are going on in those kitchens and the outreach to the owners of those facilities to ensure that they are preparing and serving food to the best of standard and quality for avoiding foodborne outbreaks. Also, we do inspections in daycares, we do inspections in schools, we do inspections in hospital facilities. So it is a wide breadth. We also inspect tattoo parlors.
In addition to inspecting your favorite spaces, public health departments are responsible for vaccines and immunizations, case management services, WIC services, and more. The Department of Social Services is responsible for most public human services programs, issues, and policies, and works with the Department of Public Health to care for residents.
On the clinic side, we do a broad range of immunizations, what people frequently know as childhood vaccinations, and in our county, adult vaccinations. We're a key provider of that service. We also provide case management services for at-risk pregnancies and children birth to 5 that are at risk and have higher need for their case management to have the best possible childhood outcomes. We focus very much on well child assessments, being sure that children are connecting routinely with their pediatrician or through our enhanced role public health nurses for their well child assessments so that they can mark and watch for developmental milestones as appropriate in those children. We also provide WIC services, and WIC serves pregnant women that are income eligible and their newborn babies and their children up to 3 years of age, and that focuses around a food package and education and nutritional support, so that with the WIC vouchers, families and parents are making the best possible nutrition investments for their young children and for pregnant women. Sometimes it's the only nutritional education that many clients receive in the course of their young child's life. The other area where we provide a critical service is in family planning services. We provide methods of birth control and birth control education, and frequently STD education to individuals seeking birth control support through our clinics. Historically, public health has been called the silent miracle because so much of what we do, if we are doing it and doing it well, it just happens in the background of the flow of society. Whether someone is a high need family or from a family with resources who just chooses to pursue our clinical services, we value the lives and needs of all clients that come before us and want to be sure that we serve them to the best of our ability. Please know that public health always works quietly in the background across community health data, clinical services, and environmental services to protect the health and safety of every single solitary person in a county, be they a permanent resident, part-time resident, or a tourist who is with us for a short period of time. We are that quiet and silent miracle. It's comprised of an incredibly devoted group of individuals who could work in many places, but the desire to be a public servant and the call to be a public servant and make their communities better is very strong. So many people in public health truly have a servant's heart, and they just want their communities to be healthy and okay. So I would encourage people to remember that when they think about public health and not always define it through one particular lens.
Stay tuned for the next episodes of County Lines, discussing parks and recreation and elections administration.